So welcome dear viewers to a new episode of Around Kuwait. Really happy to welcome everyone, especially when it comes into today's episode. As usual and as everyone knows, in this program, me and Abdul Latif will going to talk more about specific things that happens in Kuwait. But in today's episode,
we have a special thing actually. Today we have a special guest that's going to tell us all about his field. And with that, of course, we're going to present our guest, but after the short break, so stay tuned, our viewers.
welcome back, dear viewers. We're really happy to welcome with us our guest. I mean, he is one of the best topics when we're talking about it. Everyone loves them. Everyone is not really terrified from them, but they really enjoy going to their clinic. We're talking about our dentists. We're really happy to welcome with us Dr. Raja and Ladawi. He is a restorative and cosmetic dentist. Really happy to have you here.
Thank you for having me, guys.
You're welcome. You have a special passion as a restorative cosmetic dentist on the field, and you've been known for a while. But what inspired you, especially on this field exactly?
The field of dentistry, but specifically, is I grew up in that environment, so I always had this affinity for science and sciences when I was younger. And you know how your parents auto train you to be something, and so always when you're a kid you're like, hello doctor now, or hey doctor, or hey dentist.
The pressure is really
high,
you know?
And when I was really young, as a toddler, I was 5 years old, I remember like yesterday. You know how when you're really young you form these core memories, and you have these memories from when you're a child. And my dad took me to my grandfather's clinic. He had a private clinic in Hawali, somewhere on that main road there, and I went there, and it was just in your subconscious. And then from then, with the motivation from your family and your love for science, I think this is what you get.
You have to love it, even if you hate it at some point. But after a while, after a time, they keep calling you doctor. You have to you keep seeing it on your eyes until you have to love it at the end.
You live up to the expectation. You have to step up to the plate, right?
Exactly.
Yes. So we can tell that from your background that your grandfather used to be a dentist. Therefore, we rise to you this question. In that specific age, you know, everyone was terrified of visiting the clinic.
True.
Now you have your grandfather, so I'm very sure that relationship was really great, but yet again, did you had that experience that you're terrified, you don't want to go and have a checkup?
No, not really. I used to go have fun. I used to go play around, and I do the same thing with my son now.
Yes.
So I bring him to the clinic, he comes and sees, he's not on the chair from the first day. So he sits, he plays around with the putty, he sees me dealing with patients. And that's what my dad did with me, with his dad.
Yeah.
So it's kind of...
Well, that's really great.
Circle come complete.
You had a great relationship and history.
Yeah.
Like, to be honest, Abdul Latif, I used to remember me going to the clinic and they used to tie me.
I remember that.
It was a very terrifying memory.
It's not like that anymore.
At the first time, I think. It's only be at the first time, but after a while you get used to it. Like it's okay.
You do.
I'm gonna get out of it alive.
Yes.
So this is what's most important.
No, it was the dark age of the clinic
dentistry.
at that time. Yes,
I
it was
think
the
so.
dark age. But now you can see it's way different.
Yeah, it's not done anymore. Your first impression is the most important one, so that's why the dentist should actually be very careful when introducing a new patient. You don't say, hi, how are you? Sit down, open your mouth, and I jump in. It's just not done that way.
But you didn't want it to be a regular dentist, like any other dentist, like fixing teeth and no. It's not only that. You want it to be restorative cosmetic.
Yes,
dentist.
I like the cosmetic touch.
Cosmetic, yes. You wanted this field especially. Why is that?
Yes. I tried other fields. Now, when I first graduated, we had to do ST training and stuff. So I tried being a surgeon at the hospital, but it wasn't the lifestyle I wanted. I didn't really want to be called up at 2:30 or 3 a.m. because there was a car accident or a fight, or it's just not the lifestyle I pictured myself, because I always wanted to have a nice balanced one for family time and work life. So with dentistry and in private practice especially, you can have your 9 to 5 or your hours, and then you have time for your family. So that's why.
Good, yeah.
And the love for cosmetics, so I always had that.
Yes.
You know, it was always something I was into, passionate about, you know.
True.
Yeah.
That's
So
really
I know, I don't really know what's the connection. There's always the situation where you have that pain of your tooth in the middle of the night, and you
Yes.
start searching
Yes.
for doctors. Where can I find a doctor that could treat me at that specific time?
And they're all
But-
closed.
Exactly.
Yes,
Yeah, exactly.
yes. And that's the
True.
most, let's say, challenging thing is now we actually do have some clinics that open 24 hours.
Hospitals
especially-
too.
Yes, and especially for children and kids,
Mm-hmm.
because they're the ones who are really into pain, and we cannot, of course, maintain
Get
that
it
kind
done.
of pain. But we're talking about cosmetic, especially nowadays. We've seen so many. Not really only adults, but even when they're teens, like 16, 17, they do want to look very great, especially that they're graduating from high school. They want to, take that perfect picture.
The yearbook picture, it has to
yearbook
be, they have to go to
yes.
the dentist.
Oh
Yes.
yeah, 100%.
So tell us about the proper age, because we've seen so many teens, to be honest, are actually doing major change in their teeth, having, let's say, some veneers and so on. So tell us more about that. Like, where do you think the appropriate age is?
I wouldn't do anything if they're under 18 initially. Now, minor things like, usually at that age when you're younger, you're more prone to break your teeth because of accidents. You're more prone to have issues because you know how you go through that age where you don't care about yourself and your appearance, and suddenly you're a teenager and you care about how people look at you. It's important.
Yes.
So in that period, that's when we get a lot of issues. Now, if a person breaks their front tooth or whatever, I can give them an option where we just put the tooth-colored filling to make it look like a tooth, and then defer the treatment if needed for when they're older. Because for veneers and stuff, it's a luxury, keep in mind. So kids shouldn't be doing it. And even when you're younger, it's a big decision. So you have to be ready for it, know all the pros and cons, think about it before doing it. It's not just a decision and let's just go with the fad. You know?
Exactly.
Yes, indeed.
Yeah.
Exactly. So can you explain one of the concepts that you already have on your field, which is be natural? Can you tell us why do we have it, and what does it actually present to you?
Okay. When I'm talking about be natural, there's two things I talk about. Now, either be natural, so if the patient came to me and their teeth are natural, they don't have any work done on their teeth, it's just natural teeth that are healthy, you don't want to do anything. Nothing's better than your natural God-given tooth. Now, if you had issues with your teeth and they're broken, spaced, decayed and carried, here I can give you an option and get you cosmetic work done, but also be natural with that. You want to pick a timeless design for your veneers, not something with the fad or with the hebba. You know how like back in the days,
Yes.
people wanted super white teeth, they
Yeah.
wanted the Hollywood smile, so everyone say Hollywood
They
smile.
destroyed all of the teeth
Oh.
that they have already, and they put a new one.
Exactly, and it's one length. Usually the old design was, they were very close to each other, one length, little chiclets and white, and now 10 years later they want to change them. So the more natural you are, you will never need to change them because it is timeless. So if you pick a natural shade that's still white and nice, you're never going to say, oh, I wish I didn't pick that color. But a lot of my patients that come to me are redo cases that did their teeth 10 years ago. And they're like, oh, doc, I wish I didn't pick that color. Because it's literally like your shirt. It's like a nice white
Ah, the natural.
color.
Ah,
Yeah.
thank you.
So imagine that color, which is beautiful,
Yeah.
but in the mouth. Looks wrong.
Nice compliment to my shirt. I
Yes.
Think about that.
Especially if you eat a blue cake.
Right?
Yes.
Yeah,
You'll be
100%.
like, oh my God, you're gonna take forever in order for it to actually go away,
True. True.
You know, so look after the take-home messages. Look after your teeth, guys. Do not drill them if they're fine. Don't go for extreme treatments. Let your dentist help you decide, and let it be a give and take. It's a
Yeah.
decision you have with your dentist.
Yes.
It's not.
Don't destroy it.
Yes,
Exactly.
thank you.
I think one of the most common treatment that people would like to do is whitening their teeth. And some of them is like, I don't want to go to the clinic. It's maybe a little bit higher, therefore I can do it at home. and they could take, let's say, some kind of paste treatments, etc., that actually could fit their teeth and so on. But we know that these cases are really sensitive because it ends up, let's say, if you stayed a lot in using these kind of materials, it could let's say, loosen the teeth and could make some cracks if you stayed for a longer time, because there is a specific time. Some of them actually sleep with it. With the, I'm not sure, is it a paste or is it something, you know?
I think you're talking about the strips that you put on the teeth,
the
right?
Strips, yes. So
those
tell us
are
more
not
about
controlled.
them. Yeah.
All right. These are not controlled. Now, when we do home kits for our patients, because we do offer home bleaching.
Yes.
So what do? You take impressions of your teeth, so you get a customized tray that fits just on your teeth.
Exactly.
So when I place my bleach inside the teeth to bleach them, and I put them on my teeth, there's no excess that goes out on the gums and stuff.
Yeah.
With the strips, it's not controlled. Your teeth are not flat. The gum goes down in between all of them.
Yes.
So when you sit and fold it over, you can actually be bleaching the gum as well. You can get white tips on the gums.
Yes.
If you sleep with them in, you're right, for a longer period than what's prescribed, you'll get super sensitive teeth. At least when the home kit's done by dentists, they're more controlled. They're designed in a way to protect your gums, and we can also tell you the mode of wear and how many hours I want you guys to wear the bleach, for example.
Yes.
Okay.
Well, I had that situation, to be honest.
no.
Like, my doctor actually prescribed it for me, and he was like, just put the paste on the spots. And I was like, being so generous, you know, and just filling it. And then I kept it and slept. When I woke up the next morning, it wasn't painful, but I was really shocked because my gum on the right side was bleached.
White.
It was white, and I was like, what's wrong?
You couldn't wipe it off, huh?
It
Yes.
took a couple of days for it to go actually back. But yeah, it was very terrifying, especially it's the front gum.
Yes.
It's not the ones on the
So
side.
you couldn't wipe it off.
Exactly.
Even,
If you smile really hard, there's be extra white on top. So yeah.
We're lucky it doesn't last long, so you're fine now, right?
Alhamdulillah.
Alhamdulillah.
Yeah, alhamdulillah. So for me personally, I didn't try to have any cosmetic restorative surgery on my teeth. I didn't change anything, but for me, I always wanted to be natural.
Good.
So that's actually a good thing. But
Yes.
if there's like a person and they need a little bit of change, is it okay? Like they need to change it a little bit, like change a couple or two. But unfortunately, for a lot of people, they already, let's say, needs to be destroyed, and they do it and on purpose. So they want to do some cosmetic restorative surgery. Do you advise them, like, let's say, to do some work on it?
It's minor changes give you the biggest effect, basically. So when I sit with my patients and they talk to me, in the consultation for the cosmetic treatment, I give them a mirror and I tell them, listen guys, I'm not here. Look at yourselves. Tell me everything that's bothering you and I will try to take you there. Because I need to find out what the patient's complaint is and I'll give them my solutions. You obviously don't want to go for all of them if they were not done or if they're not needed. So in that same appointment with the mirror, I ask the patient to smile. Some patients show 10 teeth, some patients show 8. Some patients don't care about the lower teeth. Some patients, the lower teeth don't even show.
Yeah.
So after targeting what the issues are aesthetically, here I come and give them solutions. And I tell them there are simple solutions and there are more drastic solutions. And these are all the options basically. And then I would advise for a certain one that's more suitable to that person's dentition and teeth.
That's really great.
Yes.
Okay, that's
Well,
how we
that's
do
the
it.
most important thing, I'm very sure. Of course, we're going to continue with you more on the interview, but the viewers are going to head to a break, so stay tuned to this.
Awesome.
Welcome back, our dear viewers, as we continue our interview with our beloved doctor, as a cosmetic restorative dentist, Dr. Rajal Abdawi. Thank you for being with us.
Thank you.
So, doctor, continuing on the question that we have already, you mentioned something that, which is each smile is like a fingerprint. It has to be rare, it has to be really good. Can you tell us exactly about this philosophy that you have?
Okay. Each smile is a fingerprint. It's just like all of us here. Nobody is the same as the rest. We're not like little cookie cutters where everyone is a factory line and we're the same. Everyone has different characters, everyone has different personality, everyone has a different face, different proportions of lips, gums, teeth, forehead width, golden ratios. Everyone is different. So when I customize a smile for someone, I want it to match their face, the proportions of the face, target what the patient wants, and also match their personality. I don't give someone aggressive, dominant canines if they're the shy person sitting in the room and not talking. And I do not give a very outgoing public speaker very rounded, small teeth to hide them in. I try to match his character. So a lot of the appointments, like the initial appointment, a lot of my initial consultations with the patients are getting to know them as people. And then that's how I kind of already have a rough idea in the plan to give them something nice later.
That's really great, actually. Great philosophy.
It's
I need to
awesome.
mention that.
It really is.
Yeah.
Everyone's different. You don't want the same smile for everyone because then it's not cosmetic dentistry anymore. It's
Indeed.
everyone's driving the same car, everyone's wearing the same clothes.
Right.
It's not,
Yeah.
it doesn't work for me personally. So, yeah.
You know, one of the challenging things that face you as a doctor is the patient. We've seen so many patients that they're really tacky and they always change their mind, you know? Like for instance, they go for you as a consultation and then you'll see them next to the doctor that's next to your maybe room taking another consultation because they are still thinking of where should I do, what should I do? Even if you, let's say for instance, tell them that you don't need a Hollywood smile. She'll be like, okay, yes, you're right. And then immediately she will go to another doctor until she get convinced that, for instance, they have to do for her a Hollywood smile. So tell us about that. Tell us about this kind of challenge that face you with the patient.
Funny thing you bring this up because I actually tell my patients, go somewhere else. Get another consultation. لأن there's not only one way to cook or bake a cheesecake. There's so many different recipes.
Right.
It's not only meal صح في غيري. Yeah, there's a lot of different people out there. So it's different options. At the end, it's an artistic touch with a medical touch at the same time. Go. You need to know. So when they're done with me, I'm like, listen, I'm not the only dentist in Kuwait. Go look at other options. See if you really need it or not. If you're still up for it, you're more than welcome. You know where I am. Because it's an open door policy and my patients are literally become friends in time.
Yeah.
It's a different vibe. So it's good to go and see. You never go to one consultation and khalas, I'm in. No, you take more than one opinion.
So,
I think it's important.
So let's say it will back up to the decision that you want to do.
Yeah, most likely they'll come back.
Yeah,
and
so we can decrease the chances that you're going to regret, because a lot of people says, oh, okay, 40 to 60% I'm going to regret the decision that I'm going to make. But if I have, like, let's say more consultations.
Yes.
But it's not
A different
good to the
idea.
doctor. I mean, when you see them to the doctor next door, I mean,
not at all.
Can be sensitive a little bit.
The way I see it, we're all colleagues, okay? And this is how we do it in the UK, by the way. We're all colleagues, we're all on the same team. Great, but go and get another option. It's absolutely fine. It's not something that'll make you feel bad, بالعكس, because a lot of them would come back.
Yes.
And some of them, I tell them, not only go see other doctors, I'm like, wait on this decision a year. If you still want it in a year, you come back to me and I'll do them for you. They come back in a year, so I know they actually want it. Not, all right, you want to smile? Yalla, sit down, let's drill your teeth now. No, if this ever happens, stand up, say, guys, I'm out of here.
Yes.
Okay, because it's not on the spot.
Yes.
Feel awkward and do it.
I
No, you
did
think
have
about
that
it.
situation with my cousin. Like, the doctor actually told her, you know what, wait for a year. Because she's like,
Good.
I want a veneer, but I don't want a veneer. And he was like, and she's still, let's say maybe it's now almost 10 years.
Yes.
And she didn't still make the decision
Yes.
of putting the veneers.
Informed consent. Informed. You have all the mu'tayat, you have all the info given. You take a decision from a right spot.
Right.
When you know all the info.
So, doctor, can you share with us some of the success story that the restorative work you made to a client that changed someone's life? I mean, of course, you had this react from them
Yeah.
that they will always cherish. And for you, this memory, you will
I like
always
it.
cherish it. Share with us one of these stories.
I've had a few actually. I have a lot that come to me, get their smiles done, and then when they're back for their review, because after you get your smile done, you need to service your teeth. It's not like I did my smile, ma salama. It's we did our smile.
They think 10
We
years,
serve-
actually. They think 10 years, they don't need any work on it.
Every 6 months to service. So these patients come back on their service appointment. They're either married or with a partner, and it's so like I feel special. I feel like I had a hand to play at this. It makes me feel good. I'm
Yes.
actually, it gives me job satisfaction. So you see a lot of them happy. Some of them come back to you completely different, more into the gym, lost weight. You feel like there's some self-love because that is your smile is related to that. You know,
It is,
it's
it is.
super important. It's everything about you.
Well, that's really great
yeah.
to hear. I think one of the things also that happens when it comes into cosmetic dentistry is we've seen people who once, let's say, bunny teeth, and they have exactly a great teeth, but they just need to make more length for the front teeth. Or, for instance, there's also a scene, I'm not sure if you're familiar with Abdul, but vampire teeth, like they want
yeah,
these
the
to be
vampire
more
teeth.
longer.
Custom
Of
smile.
course, I'm
Yes.
familiar with it. Yeah.
So tell us more
So am
about
I.
these decisions.
All right. Well, it depends on the type of patient, and you do have to know about their jobs, their lifestyles. Some people are really into this stuff, and they just want it because they always wanted it, and some people just want it because their neighbor got one, and
Yes.
some people actually it
Most of
suits
them
their
like this
face.
actually, because they know one of the friends,
Yes.
they have dated a Hollywood smile, and this is the trend, this is the habit that's happened.
Thank you. And we don't want
Yeah.
hebbas, right?
Yes.
We don't want hebbas. We don't want trends.
Yeah,
Stick
we
to
don't want that
timeless.
because
Yeah.
a lot of people regret it because
Yes.
it starts to smell, it started to destroy, it started to do it because they unfortunately, they didn't want to do it here. So a lots of them they traveled. A lot. I'm talking about for me personally, a lot, hundreds of people
I've seen it too.
traveled to do it, and then they get back with really they destroy it
Yes.
for nothing, for nothing. I mean, why is that? And all of them they're regretting right now.
Unfortunately, these things happen. Now, I've had a few cases like this as well. It's not foreign to anyone, but when you go to travel just for the price point and you think because it's cheaper, we'll do it. At the end, you're going to pay twice to do it, get it done. So if you paid more in the first place, you're not going to have to pay for the same smile twice. Do you know what I mean? So it's all
Exactly.
about quality, not quantity, and let's just get it done. You know, so patients do come back. They'll start experiencing issues, let's say 6 months to a year down the line, and then the hardest work for us as dentists is doing a redo of cosmetic work. If you come to me with fresh teeth, it's so much easier for me as a dentist. Now for you, as a patient, it's the same. If you've got veneers or not, and you're getting them redone, it's the same experience. But drilling through old crowns and veneers takes so long. You can ask any dentist out there. We do not like it. We burn through diamonds like hotcakes. And we change the diamond, burn through it, change it. So it is tougher on the patient because it just takes longer for them. So a simple experience just takes long. That's about it. So the redos are the trick.
Yes.
Getting them from fake back to natural.
Natural. Yeah. I mean, I had root canals, and because of that treatment, I was like, you know what? No Hollywood smile, no veneers, no nothing. Because I mean, having a root canal and crowns is really actually kind of similar. It's like mini Hollywood
Yes,
smiles.
it's
you know?
one tooth. It's a
Yes,
one tooth.
It's only one tooth,
smile.
and you have like I have 5, for instance.
So you have 5 crowns. That's
5
half a smile
crowns.
done.
Yes, like, can you imagine that? So it's very tiring to maintain the health of the gums, trying to maintain the teeth itself. You know, it lasts let's say for instance, a very long time, but again, you have to take lots of treatments in order for you to actually maintain the health of your teeth, your smile, and everything. So when it comes into that, when it comes into such treatments, people who are into, let's say, cosmetics, and they're really into being perfect, how can they maintain the health of their mouth, their teeth, their smile?
Very nice. When they're done their smile, I tell my patients, treat your teeth as if they're your own teeth. There's no difference. If you're going to brush and floss, that's all the maintenance you need.
Yes.
And just be wary of habits. A lot of people have habits. They like to bite pens or bite their nails, or they have the people like to eat benek, crunch ice,
Yes.
stuff like that. obviously you might damage your veneers at the end of the day. You might damage your natural teeth with that stuff,
They think
let
it's
alone.
okay because it's not that actually not that solid.
Yeah, but it over and over every day. So if I'm biting my pen every day, it becomes a subconscious habit. So you're basically doing it 7 days a week, 52 weeks a year, 10 years, times those numbers with each other. So
I mean,
numbers.
even eating an apple is hard, you know. Some people
That's fine.
but some people bite it really hard because they feel like it's something like we could actually, for instance, do.
You can with veneers.
Yeah.
You can. It should
It's
be
fine.
fine. Yes, if their
So
teeth are sturdy and it's good material, you're good.
Good.
So, doctor, how do you stay up to date to the latest trends and to the latest habbat, if you can mention it?
Habbat or trends?
All of it, and also the latest, let's say, to the development on the field.
Okay.
Because as everyone knows, every month, sometimes every week, there are new technology, there are new trends. How do you stay up to date with it?
With dentists especially, we have a lot of conferences every year. So I go to about 2 or 3 a year. Now, in those conferences, you have speakers from all around the world with all their expertise coming and giving lectures from morning to night on days on end, which is, I think that's very important for your continuous professional development. We have that thing in medicine and dentistry where dentists and doctors have to study certain hours each year and go get lectures and stuff.
Because after a few years, if they didn't continue,
You're stuck.
the experience,
You're stagnant.
they're going to stuck.
Exactly. So with the lectures and stuff, we do workshops as well. So there's a lot of dentists and workshops around the world where you can go and do hands-on training for specific interests that you like as a dentist. So if I like gums and implants, I can do a workshop on implants. If I want to do veneers, I can do a workshop on veneers. And then on top of all that, you can do the academic stuff. So for example, like I'm in a program now with the British Academy of Implant and Restorative Dentistry, and it's never bad to have another diploma or another degree. You can sharpen the saw, right?
Yeah.
You gotta always be on top of the game or else you're gonna just
Especially
fade in
when
the
we're
back.
talking about the medicine field, it's always, you have to
Always.
always be up to date and always studying when it comes
Of
to that.
course.
So may God give you all the energy to that and
yes.
for more success, of course,
Thank
in
you.
that, let's say. So we've seen so many patients, especially when we're talking, let's say, about the patients that you deal with. They are the ones who know nothing about dentistry, and then we have the ones who study the whole field itself. And once they attend to the clinic and you start to treat them, I mean, they start responding with you, you know, like bring for me, for instance, this tool, you will see that the patient is actually, let's say, participating in that. So how do you deal with them? Like,
I call them the Google patients.
Yeah.
So the Google patient comes, Dr. Google, and they have all the info. I like it. It's nice in a way, but no practitioner ever lets the patient direct the surgery or the treatment. You know, you can't go to a restaurant and you want to go eat a beautiful recipe. You don't tell the chef, shuf, please, put extra salt here, cut half a lemon. No, you just go and you know. So I do get a lot of that. It is fun. I find it a challenge, but a fun challenge, because the way in my clinic we break the ice a lot, so we don't have this very formal interaction, because they feel comfortable enough to just let their guard down, and that's how I am. So I actually do sit. I'm like, show me, where did you read that? Show me that bit of information. Okay, well, next time Google this, and I put in a medical term to help with their search. And they're like, oh, okay, then that's why. So it's a fun thing. It's you're educating the patients. It's part of.
You know, being a dentist is kind of being a therapist, because lots
I
of
agree.
people do attend to the dentist and they start telling them what happened.
Feelings.
All the time. It's beautiful though. It's nice because it's a feel-good place. It's a feel-good zone, right? So.
It's like when you sit with them and they tell you everything that happened to them, like between the first session or the previous session and this one.
Beautiful. I'm the same. I tell them
like
what happens with me too.
I've always wanted to ask a doctor about that. Do you get annoyed from that, or you just want to get your job and then like next patient?
It's not a job for me. And you know how you just said next patient?
Yeah.
I don't run the clinic that way. I do it very differently. Your appointment with me will be 1 hour long. Be it's just a talk, it's one filling, whatever, minimum 1 hour. So we're going to sit, we're going to properly examine your teeth, properly get your x-rays done, properly check that not only your teeth are healthy, because dentists aren't only teeth. I want to make sure your mouth is healthy, your soft tissues are healthy. Especially in our region, a lot of people smoke. So I need to make sure that all the dangerous areas that we need to look out for are clear. And then we sit and have a chat and talk about educating the patient, showing them how to maintain their teeth. It's not only, okay, open your mouth, you need 5 fillings, I'll see you next week.
I see.
We're not cases, we're people. You're not
Right.
a tooth, you're a person. So
Yeah.
Right.
I'm a person too. And that's how we get stuff done.
That's
Yeah.
really great, actually.
Indeed.
So, doctor, can you tell us about how technology improved your experience on the field of the restorative cosmetic industry, dentistry?
And dentistry in general,
In general,
technology is, everything's going digital these days.
Yeah.
So there's a lot of digital dentistry. So I remember I used to take analog impressions all the time now. Now 50% of the time I'm scanning teeth. So that makes it easier on the dentist because it's quicker and I can save it. So I don't have boxes full of teeth and stones in my clinic.
Exactly.
It's easier on the patient because the patient doesn't. Have you ever had an impression taken,
Yeah.
guys? Do
Yeah.
you know that some patients get
Yeah.
that claustrophobic feeling or they want to gag
Yes.
with scanners?
I always
don't
get
have it.
scared that my tooth is going to
Pop
go
out.
out. Like,
Yeah. You don't get that anymore because we kind of
Yeah.
scan them with the digital scanner. It's an intraoral scanner, or masah dawi, they say in
Yeah.
Arabic.
yes.
So after scanning the teeth, I have it on a screen, on a computer screen. I can just show the patient, by the way, these are your teeth. I can turn it around and show them exactly different places where they're missing out or if there are cavities and stuff, because you can get a color scan as well. So you can do monochrome or color, you can see it. It's pretty
Yeah.
interesting. And then after the scanner, we use 3D printers nowadays to print the mouth. So the old school way, stone, mix it, pour it, let it set, it's still a good way, it's not a wrong way. For some tricky cases, I still go for the analog. But as time has gone past, digital dentistry has become so much better. Scanners have become so much more accurate. Printers have become so much better. So we're going towards the digital route, I think. And it's nice to visualize and see everything.
Really, really?
So I show you your smile with your face on a tablet without even touching your teeth. The older way was, I'll show you your smile on stone, built in wax, so you can imagine, and then we do a test drive. Here, I don't even need to do a test drive, you just see it. And we can change design together.
Yes.
You know what, I want canines, I want the vampire teeth,
Yeah.
or I want the bunny smile.
Oh.
Those are your major hubbas,
Yeah.
right?
Yes. These are the major.
The major hubbas, sorry,
So-
the major trends.
So when we're talking about, I mean, to be honest, X-ray used to be very challenging because you have to move and shift to another room.
Yeah.
Now you're just sitting and everyone is running away, and you're like, okay, I'm just here.
Oh, X-ray?
Yeah.
It's digital. It's digital X-rays. They're very low dose.
Yes.
Okay. You know, back in the day, you'd see all the dentists and stuff hiding behind the wall as
Yes.
if they're shooting some nuclear. Guys, if an airplane, if I fly from here to Dubai, for example, I'm getting more than 10 X-rays, much more.
Yeah.
Okay, than their little intraoral
Yes.
ones, because they're such a low dose.
Yes.
It's negligible.
Indeed. So I think one of the most challenging thing is Abdulatif is when we see the dentist start to talk to the patient while they're working
Yes.
on their teeth. Like, why do you actually do that? Like, is there
Yes.
a case
Why?
for it?
Do you guys want the
Truth?
honest answer?
The honest.
Or do you want me to just, you want the honest answer, right?
Yes.
Okay. The reason we do that, the reason I do that, okay, I deal with a lot of phobics as well,
Yeah.
okay? Because I used to be
Yeah.
a phobic when I was younger. I'm distracting you by talking to you, even though I can't understand how you're saying back to me,
Yeah.
and you don't even hear what I'm saying because the drill's in your ear, you're getting distracted. So you're distracted from the sensation, the pain. So I'm kind of taking your mind off these things.
That's really good.
And that's why, and I do it only in certain parts. It's not like we're sitting and talking throughout the whole procedure. It's certain times and you're like, what did he say? And I see the eye roll. So I see, okay, the brain is clicked, they're thinking. So they're distracted from the painful stuff. Or it's not really painful,
That's actually really great.
but the
So of-
uncomfortable stuff.
Yeah, so of course, doctor, we have more questions, but we have the short break. So for your
ahead.
viewers, we'll be right back after the short break. So stay tuned.
So welcome back, dear viewers. We're really happy to continue our interview with Dr. Raja. So, doctor, one of the also challenging thing is we've seen so many patients that they go through the process, especially female, and then suddenly they're pregnant. So what do you actually do? I mean, do you stop, let's say, treating them for a certain time, or is it okay for them to, let's say, work during their pregnancy with the dentist?
Well, does it make a difference? I don't know about that.
Dental treatments for pregnant ladies is quite safe, especially if you need it. Okay. Even taking an emergency X-ray is actually fine.
Yes.
We do go the extra mile and put lead aprons and stuff, but it's a true emergency. You're in pain. Of course you can get it treated, okay?
Yes.
The only thing is in the first trimester, there's a lot of drugs and things you want to avoid, you don't want to load the patient with, but throughout pregnancy, it's very important. If I know the person's pregnant, I always ask to see them a few months down the line, because with pregnancy, your hormones are imbalanced and you get a lot of gum issues and they start bleeding, and so they need to get their gums and teeth serviced so that it's not painful and not bleeding. So no, I think you can
fine.
get away.
Yeah.
It's fine.
It's just a big misconception that no, I'm pregnant, so no,
Yeah.
I'm gonna wait for it to abscess and then inhale.
Yeah, because this is the problem, and the problem is in the end of the trimester, let's say in the end of pregnancy, is where the problem begins. It starts to become severe.
Yes.
For instance, I had a root canal treatment with my doctor when I was 8 months from my pregnancy, and he was like, you know what, I'm not going to give you the whole drugs, like a certain, there was a certain time of a part of, let's say, injection, and he was like, because I know you, and I know that you can deal with pressure, so you're going to survive this.
Yeah.
So, you know, it was really challenging. And I was
Exactly.
trying my best to find any clinic that could actually treat me. And it was only for my doctor who's like, I can do this, just come immediately, you know? Yeah.
And got you out of pain, made it more
Yes.
comfortable for
Yes.
exactly.
So, doctor, tell us about, are there any common misconceptions that you have on your field, and how do you address them?
Misconceptions in
That
cosmetic
you encounter,
dentistry?
yeah, in cosmetic dentistry.
Well, a lot of people think that getting veneers done means the dentist is going to drill your teeth into little shark teeth. That's not true. If you've got root canals and most of your tooth is a filling, then yes, I'm going to prep it for a crown. But now with conservative cosmetic dentistry, you want to maintain the tooth structure as much as you can. So it's very minimal prepping of the teeth. I post a lot of it on my stories and stuff to show patients. It's not only for doctors to see. I want patients to see so they don't freak out and say, oh, there's shark teeth underneath. So I show them. I'm like, look, ta-da, it doesn't even show. It's a very minor 0.5 millimeter reduction in
Just
the
need
cases.
for the veneers to be
Just to
stuck,
stick. You don't want to ledge. No, because the misconception number 2 is bad smell will come. You'll get halitosis. My gums are going to bleed.
Yes.
No. If you do it right and accurate and the fit is perfect, you're not going to get that issue.
I mean, even after years, let's say.
Even after years, of course. If you
Because-
had a
because
ledge,
I smelled it for lots of people that related to me.
Yes.
They went to other countries, they did it really cheap. I mean,
that plaque
10%
is
of the price,
collecting.
and they come back
Eh.
with the bad quality.
Yes. Halitosis mainly is from the tongue, but yes, if there's a lot of plaque and bad environment in the mouth, you will be smelling stuff. ولكن if the fit is perfect,
Yeah.
you know how I explain it to my patients? Imagine we're going looking for a house. We want to go and move to a new apartment. And you look at the bedrooms, and some bedrooms have built-in closets where the closet is built into the wall, and then there's some where you have to actually buy the cabinet and put it in the room. Now, if you buy it and put it in the room, there's a big ledge on top. All that dust is going to collect up the top. Same with the fit of the veneer. The built-in ones were part of the wall never get any غبار on top.
Yeah,
Because
of course.
خلاص, it's part of the wall.
Yeah.
So imagine the dust is the plaque and the jir and the mouth. فالأكل and all the bacteria gets collected around those ledges. So if the fit is
Exactly.
closed, and it's not open, and it's done perfectly and precise, there's no issues at all. As long as you're
really
maintaining
great.
though.
Yeah.
Move
So-
veneers and not brush.
Doctor,
And not only brush, flossing.
Important, of course.
I mean,
Yeah, exactly.
most of them, they don't floss. It's
You
like
have to floss.
They see that flossing is not really that important, or I don't want to just go and floss, you know. Though once you use the flossing, you'll be so amazed
Of course.
what are the things that are
Yes.
between the teeth.
Patients see that if they floss and bleed, like, "Oh, it's bleeding, خلاص, I'm not going to floss. It's the opposite. the more you floss, the less you'll bleed in time. You might bleed a lot today, a little bit less tomorrow, but in a week's time, it'll be gone.
It'll be gone, yeah.
So it's important because our teeth are one surface, two surfaces, and three surfaces. Surface 4 and 5 have teeth on them. You need to clean those guys too.
Yes, especially that it relieves the pressure. Sometimes you have this pain and you go to the dentist and you don't know what's wrong. Is it the veneer? Is it the filling? And then it's just
It's
flossing.
just plaque and calculus, yeah.
So, doctor, you told us something like 3 minutes ago, which is that you posted on your story. Before the interview, you told us that you were like your public your social account
Yes.
were actually private.
Yeah, it was a very
And then you
private
had to
account.
open it public.
Yeah.
Tell us the story also about that.
Yeah, I was with my peers. والشباب were like, رجال, you have to, لازم, you have to make it public. And I was very wary of that, you know, because if my friends know this, like I'm usually quite nervous. I don't like public speaking and stuff. But when I'm in it and it's fine, you know. So they told me, try it and try making it public. So I said, okay, you know what? I will make it public, but it's not going to change me. I'm still going to be myself. That's why if you follow and see, I'm still me. I don't do the الحشوات الوقائية, but I don't do it very formal. I'm not that type of guy. I'm not that type of guy. You see it, I break the ice, and it helps because before you come to me, you see a portfolio of the work I do. You also get all the info, and you've seen me talk. I already كسرت حاجز I broke the ice basically.
You broke the ice
You know
with your
me
patient.
before you come to me.
Yeah.
I get to know you when you come to me. But I don't know who you are, but you already know who I am. So it's kind of a great icebreaker for us to get a proper consultation, have a chat. It'll put you at ease because it's not the fear of the unknown. Who's this bearded, scary looking guy? So I'm a nice guy. I might look scary, but I'm not. Do you know what I mean?
Yeah.
Especially as a dentist in scrubs,
Yes.
with
I
a
mean,
click
once they
gloves.
see it,
Come on.
They're like,
Yeah, exactly.
It's got to be scary. Yeah.
Exactly.
I can see
Okay,
it when
so
you
that's
describe
how.
the picture. Yeah.
Yeah, so it's in a way you break the ice. There's no unknown. It's a better appointment for the patient.
Yeah.
Yeah.
So, doctor, we've seen especially patients, some of them, for instance, as you just said, you create this great bond. Therefore, they've always are going to come to the clinic, and then they're going to use you as their energy, let's say, saver, the one that, let's say, they tell whatever they have, and then, you know, they get the treatment, and then they're positive, and they just leave everything behind. When it comes into you, I mean, this is more of a hectic work. You've seen so many patients during your day, therefore you need energy, you need motivation, you need something to give you a power. So when it comes into that, what, let's say, energize you after, let's say, dealing with your patient?
To be honest, I love working. It's not work to me, so I don't even feel it's my energy. Working is my energy. When someone's coming in, I'm talking to people. I love people.
Yeah.
So I might not like big groups and stuff, but I love one-on-ones. I love getting to know people. So to me, it is my own motivation. Do you know what I mean? So then I see them happy. Some of them are crying because their smile's so beautiful. It's so nice. It makes me say, you know what, I want to work more. Fun fact, even when I'm on holiday, I feel guilty. I'm like, I should be in the clinic. I should be working. It's not work for me. I really enjoy it. But if it's super stressful, I'll just go home, play on the guitar or something. I don't know. But I never feel like it's stressful. I actually love it.
Well, that's really
I
good.
It was actually really remarkable. So, one last advice before we finish to our dear viewers about their teeth, about the bad habits that they're having.
Okay.
Remarkable advice from you, really helpful.
Sure. I'm not going to tell you to brush and floss because every dentist is going to say brush and floss. Just when it comes to diet, just be aware of the stuff you're taking in, especially with the acidity. People that like a lot of lemon, people that like a lot of vinegar, people that drink fizzy drinks all the time, so that's a very, very acidic substance that you're putting on your tooth every day. So day by day, you are going to start getting issues. So apart from all the brushing and flossing, which everyone should be doing, I hope, your acidity, and be aware of the diet. Be aware of people that crunch ice. You might fracture your teeth. Don't do it. I know it's nice. Just don't do it. People that crack on Benek all day, you might break your tooth. And trust me, when it breaks and it's painful, you're going to regret doing it. Because dental pain, honestly, is horrible.
It's actually one of the most horrible pain. I mean, I can even only sleep because of that.
Of course.
Any other, let's say, any other thing that I may have, like a cold, flu, or anything,
It's
I'll
fine.
be okay. I mean, I can sleep,
Yes.
but dental pain, I mean,
Yes, the worst.
disaster.
And stick to natural. That's the most important. Stick
Yes.
to natural. Nothing is better than your God-given teeth. If you have major issues and they're broken, or you got veneers done in another country, or you went on medical tourism and you need me to change them, then okay, we get something done, but nothing's better than what you naturally have. Maybe just the bleaching would be your option.
Yes.
Be
Always think of
natural.
that.
As
Yes.
our doctor mentioned, be natural. It's actually what's most important.
I
Dr.
agree.
Rajal Al-Dawi, thank you for being here with us.
Thank
to
you for
share
having
with
me.
us your remarkable journey, the story that you just mentioned,
Habibi,
the
thank
vibe
you.
that you are having was really remarkable. I actually envy your customers and your
Habibi, thank
clients
you.
because of the really good way that you are treating them.
Thank you. Thank you for having me, guys. It was a pleasure, honestly. Fantastic.
Thank you. And with that, dear viewers, that was our episode for today. Hopefully everyone enjoyed watching us, and join us again in different episodes.
So, goodbye and stay safe.